to our virtual presentation on oral health care for older adults and caregivers, put on by Massachusetts College of Pharmacy and Health Sciences and the Worcester Senior Center, which is a virtual workshop for the Worcester older adult population. My name is Bonnie McCurris, and you will also be seeing my colleagues Stephanie McPhadries, Carol Fig, Sarah Maldari, and Jaylene Maldonado. We also have Dr. Laspina joining with us today, our instructor. We would like to welcome you to come on down and visit the MCPHS clinic. We're open to all orientations, ages, incomes, and abilities. We would like to start off our workshop by testing your oral health knowledge. I encourage you to write down your answers now, as we will visit these questions later on in the presentation. So go ahead and get a piece of paper and a pen, or try to remember what your answers are. Okay. 1, true or false? Implants do not need to be flossed daily because they are not real teeth. 2, true or false? A patient with a full denture still needs to visit the dentist twice a year. 3, true or false? Periodontitis is curable and reversible. 4, true or false? Dry mouth is a major risk factor for cavities. And 5, true or false? Only sugar causes cavities. All right, and now we're ready to begin our presentation. Here's our program outline. Once again, my name is Bonnie McCurris, and I will be going over brushing and flossing. We will have Stephanie with denture care, Carol with periodontal disease, Sarah with dry mouth, and Jaylene to wrap us up with nutrition. All right, so like I mentioned, my name is Bonnie McCurris, and I will be going over brushing and flossing with you. These are just a few objectives that you will hopefully know by the end of this presentation. They include knowing how often you should be brushing, which toothbrush could work best for you, and what techniques you might like to try. We would also like you to understand how often to floss, which type of floss or tool you want to use, and how to floss all of your teeth, whether they be natural teeth, implants, or bridges. So let's start with toothbrushing. You may be sitting there thinking, well, Bonnie, I already know how to brush my teeth. I've been doing it for 60 plus years. And yes, you're right, you definitely know how to brush your teeth, but I want you to be able to use the most efficient and effective way to keep your teeth clean, and thus spend any extra time doing things that you love to do. So I'm going to be showing you a few techniques to brush your teeth that you may have not been shown before. These methods, when used correctly, can help your teeth age optimally along with you. All right, so in order to start talking about toothbrushing, we first need to talk about our tool, the toothbrush. This is dependent on personal preferences and what fits in your hands best. You may be asking, Bonnie, what's the best type of toothbrush? Just tell us. And the answer is, it's any type of toothbrush that you'll use regularly. So these pictures actually model great ways to adapt a toothbrush for arthritis or limited dexterity. The photo on the right shows a toothbrush fit into a pool noodle for a wide grip person. The photo on the left shows a slightly smaller grip that you might find you need, and it's fit into a bike handle. There may be many ways to modify your toothbrush, and that's something you should certainly bring up with your dental hygienist, and they can help you brainstorm or come up with the best way that will work for you. Last, we have my personal favorite in the center, which are electric toothbrushes. They get in more strokes per minute with their amount of oscillations, so they do a lot of work for you. At the dental clinic, we also like to recommend soft bristled toothbrushes. I'm going to say that one more time, soft bristled toothbrushes, as they cause less wearing away of your outermost tooth structure, enamel, and that can cause sensitivity. So we want to keep the most enamel we can. To start off brushing effectively, we're going to split our mouth into 4 sections and brush each section for 30 seconds for a total of 2 minutes. We would like to aim for you to be doing this 2 times a day. All right, so Hygiene Edge on YouTube is going to demonstrate the modified Stillman technique. This technique will be utilized by older adults that are dexterous and have good mobility in their hands. So what you're going to do is you're going to take your toothbrush and aim the bristles of your toothbrush towards the root of your teeth, where your bristles meet your gum and tooth surface. We're going to use light, small circular motions, as the video is showing us, at the gum line, and then we're going to sweep away down towards the chewing surface of your teeth to get away any food or bacteria. Next, as the video shows, we're going to move to the next section of your mouth until you've covered your whole mouth. Start slow until you get the hang of it, and you'll quickly pick back up. This is perfect. Our video is showing us nice and slow and moving on to the next section just to make sure we get our entire surface of our mouth. Now we're sweeping down towards the chewing surface of our teeth. All right, next I'm going to be showing you the phones method of toothbrushing. The phones method is going to be used for people that have less dexterity in their hands, or maybe you have some joint pain. For the phones method, you're going to be placing the bristles of your toothbrush on your teeth so they are partway on your gums and partway on your tooth surface. You're going to be using light and large circular motions to cover the entire tooth surface and part of your gums. Move to the next section once again until you've covered your whole mouth. It's important not to press too hard on your teeth, and remember using light circular motions. All right, so now we're going to talk about flossing. Just like brushing, we want to be making sure to floss twice a day. And just like toothbrushing, there's many different types of flossers out there. But the best one is going to be the one that you want to use every single day. As you can see in this picture, there are floss picks, wooden picks, string floss, floss threaders, soft picks, and floss proxy brushes, which look kind of like Christmas trees. And that's commonly what they're called. Depending on the type of teeth you're trying to clean, we'll be using different techniques as well. If you feel like you need help finding the best tool to floss with, I encourage you to contact your dental hygienist or come on down to our clinic and let us help you figure out what works best. For natural teeth, we'll be using the C-shaped flossing technique. It's called the C-shaped flossing technique because you insert the floss in between your teeth and pull them on one end so that it forms a C shape around the side of your tooth that you're flossing. Just as it's shown right here in the picture, it makes a little C around the side of your tooth. You're going to be pulling the floss all the way down to where your teeth meet your gums, and as you see, be careful not to pull too hard or too fast so that you don't cut your gums. Next, we'll be talking about how to floss a bridge.
A bridge has at least 3 crowns attached together and is cemented to at least 2 supporting teeth. Floss can be used as usual at the 2 ends of the bridge because the contacts between them are not fused. The contacts that are part of the bridge, however, are connected, and therefore floss cannot go between them. Flossing under the bridge can be achieved with the floss threader. Same as a needle and thread, the floss is guided under the contact point with the floss threader that acts like a needle to feed the floss under the contact point. The area of missing teeth can now be flossed by moving the floss as usual into the sulcus of the adjacent teeth and under the missing tooth pontic.
Now we're going to be talking about how to floss your implants using the crisscross technique. All right, so we're going to start by inserting the floss around one side of your implant, and then take the floss and insert it on the other side of your implant so the floss goes around the back side. Crisscross the floss in the front, and then pull on one side of the floss and pull on the other side of the floss snugly against the top of your tooth to make sure you're removing any food or debris that's caught up by your implant. Once again, you want to make sure you're pulling snugly but not too tight because we don't want you to cut your gums. All right, to reiterate, we want to make sure you're brushing and flossing twice a day. Brush for 30 seconds in each section of your mouth for a total of 2 minutes. Floss around all of your teeth, natural, dentures, bridges, and implants. It's okay if you're not that benchmark right now, but try to build up to doing it twice a day. It takes practice to get there. It doesn't matter which one you do first, as long as you're doing it. Thank you for listening.
Hi, everyone. I'm Stephanie McPhadries, as Bonnie had said earlier, and today I'm going to be talking about denture care. So the learning objectives I'd like you all to follow today and kind of get to know is just to know how many times a day one should clean their denture, know how to properly brush a denture with the circular motion technique, know how to properly self-inspect the oral tissue when removing your denture, and know the importance of continuing regular dental care for a patient with a denture. So, when should we clean our denture? Well, the answer is several times a day. Whether it's in the morning, whether it's right before bed, after you eat breakfast, lunch, dinner, any snack. We want to manually clean your denture after eating any meal, and you want to manually clean it right before bed. When I say manually, it's taking a toothbrush or a denture brush and just exactly like you do with your natural teeth, you would just brush the denture with the brush. And another way to clean your denture is an overnight solution, and that's by chemical immersion. And every night you can just leave it by your bedside in a chemical solution, and you can just leave it there and it will remove any debris. So the correct answer is clean it several times a day and overnight. So you're probably asking, what's the purpose of cleaning your denture? You know, it's not your natural teeth anymore. Well, here are a few reasons why that it's important to clean your denture. We want to prevent any irritation to the soft tissue. Although you don't have your natural teeth there, your gums are still very important. That's where the adhesive to the denture sits. So if there's any food or debris that's stuck on your denture and any bacteria buildup, it could irritate that soft tissue. So we want to remove any mechanical irritants, and this could include big particles of food, and that food can get trapped in between the teeth, and it can also get trapped in between the ridge. And the ridge of your denture is where you stick the adhesive to the soft tissue. Because if you leave food and debris there, it can cause irritation to the soft tissue, causing discomfort. We also want to remove chemical irritants. These chemical irritants can also be caused by food or the drinks that you may consume throughout the day, and that is when the food breaks down from your natural saliva, and it can be fully broken down during the natural form of chewing. We want to remove any and all of the bacteria from the denture. Just like I said before with the mechanical, there's also chemical irritants that can sit on your denture, even though you may not see it. We also want to control any infections that may happen with the denture. So the soft tissue can become irritated early on by any bacterial growth if it's not removed early on in denture care. If it's not fully cleaned, if the initial irritant is not treated right away, then it could progress to a secondary irritant, which then could progress into a lesion. So if we prevent this first irritation from beginning just by cleaning the denture, then we can prevent any progression to another irritant or any oral lesion. Another reason why we want to clean the denture is we want to prevent any mouth odor. Even though you may not have your natural teeth, you still are going to be accumulating bacteria on the denture. Bacteria does give off an odor, so if you're talking to someone, or even you may taste the bad odor in your mouth. So just by cleaning it, you'll feel more refreshed. And we also want to maintain the appearance. So if there's some staining on the denture, we want to make sure we're removing that right away so we maintain the overall appearance of the denture. All right, so now I'm going to talk about a couple cleaning techniques of the denture. So the first one that I'd like to go over is immersion. So we're going to place the denture in a plastic container with a fitted cover. This could be a cup with a piece of saran wrap over it, or if you do have a cup with a lidded with a fitted cover over it, then that's perfect. We want to fill the cup with warm water. The reason why we want warm water instead of cold water is the warm water will help loosen any debris that's still on the denture, and it will help the cleanser that we put into the water dissolve. We want that cleanser to reach every crevice of the tooth and the denture that it can. So, and this will also help with rinsing and cleaning the whole denture. So there's many over-the-counter denture cleansers that I will name a few in just a minute, but there's a ton of over-the-counter ones. You can go to Walmart, CVS, Rite Aid, they all have them, and they're located in the toothbrush section. Some of the dental cleansers that I have here are Polident, Affordent, and Equate. But you could use any one that you feel you're more comfortable with or within your price range. And because there's so many, what's really important about the immersion cleaning technique is to read the manufacturer's instructions. The instructions for every cleanser are different, whether how long you keep the denture in the solution or how to even prepare the cleanser, so make sure you're reading that prior. We want to ensure that the denture is fully submerged into the cup, just because we don't want to miss any aspect of the tooth. And when the denture is removed, we want to rinse the entirety of the denture under running water because we want to remove any of the loosened debris into the sink, and we want to remove any of the solution from the cleanser before proceeding to cleaning with the toothbrush. All right, can we pause? Did someone raise their hand?
Did someone raise their hand?
I don't know, I heard a ding.
No, but I heard that too. I wonder if we got an email or something.
Yeah, I heard
someone rustling papers, because I hear a lot of, it sounds like there's papers rustling.
And everyone's on mute, right? Or all.
I don't know. I'm not sure. I just heard a lot of noise.
Right, we are on mute.
Okay.
Yeah, everybody was on mute. I heard the papers too.
Okay. As long as it's not just me.
Was it bad? Was it like,
No.
you can still hear me? Okay.
Yes, yeah.
All right, so we'll start with that slide, so I'll start with this slide.
Okay.
All right. 1, 2, 3, 4, 5. All right, so now I just talked about the cleaning technique of immersion. I'm going to be talking about the manual techniques of brushing your denture. We're going to spread a towel or a washcloth or any rubber mat that you may have at the bottom of your sink, and this will serve as a cushion should you drop your denture in the sink. And it also will help with, once we fill the sink with some water, it will help prevent any leakage of the water into the sink, because we want to keep some water sitting at the base of the sink. We want to grasp our denture in our non-dominant hand, not too tight because we don't want to break the denture. And you want to take either your toothbrush or your denture brush in your dominant hand. Also, we don't want to grasp that too tight as well, because we want to do light circular motions, which I'll talk about that technique next. We want to apply warm water and a non-abrasive cleanser to the brush, just like you would if you were brushing your teeth. And you want to brush all areas of the denture. So like Bonnie had said before, you can, if you have both an upper and a lower denture, or if you just have an upper or just a lower denture, separate that denture into different quadrants. So you are making sure you're getting all aspects of the tooth and the denture. One important part of the denture we don't want to miss when brushing is to make sure we get the ridge of the denture, which is the place where you're going to apply your adhesive and it sits on that oral tissue. And with brushing, we want to avoid tartar-controlled toothpaste. So what we would like you to use is a denture paste or a denture cleanser, and we want to apply that to the toothbrush. The reason why we don't want to use a generic brand toothpaste is because if you are brushing with the toothpaste, it also can create micro tears into the denture, which allows food and any debris to get in those tears, which eventually could cause irritation to your soft tissue or to the denture itself. So try and avoid those. It's a good alternative if you have nothing else, but try and use a denture cleanser. We want to rinse the denture and brush under running water. Use the brush to remove the denture cleanser. So you can brush out of the water, and then you want to push the denture in your hand underneath the sink, and then take the brush and brush while the water is running over the denture. We want to remove all of the cleanser and all the debris. So then after we're done cleansing, cleaning the denture, we want to visually check every area of the denture to make sure everything is removed. So now I'm going to be talking about the most important technique with denture care is the circular motion. So there's many different denture brushes that there are out there. There's ones with rounded ended filaments, which are, the filaments are just the bristles of the toothbrush. Those give better access to the curved inner surfaces, those surfaces that are kind of hard to reach. And then there's a rectangular portion of the brush, which is good for cleaning the biting surface of the tooth, which is where you chew. And it's also good for cleaning the facial surface of the tooth, which is when you smile, it's the surface that we're able to see when you smile. So other brushes, there's a multi-tufted, soft, regular style toothbrush, and you want to make sure that there's round-ended filaments, and you want to make sure it's soft bristles. And in the video that I'm about to show you, a dental hygienist is going to show you how to brush with the circular motion. It's exactly like Bonnie said earlier with the natural brushing technique. You're going to do light circular motions over every aspect of the tooth, whether it's the facial, the occlusal surface, which is the chewing surface, and the inside surface. You're going to use the same technique with the ridge as well. And one more note, a patient who wears a single denture, whether you just have the upper or just have the lower, make sure you have two separate toothbrushes. You can have one denture brush for your denture and make sure you have another separate brush for your natural teeth. We don't want any cross-contamination. We don't want to keep that bacteria going between the denture and the natural teeth. So just make sure you separate the two brushes. They are different. So the denture brush is a little lighter as well. So we want to make sure that we are separating those. So right now I'm going to play the video and we'll have our hygienist speak to us about that.
So are you curious on how you can brush your dentures? Well, my name is Michelle and I'm a dental assistant with Solutions, and I'm going to show you on how to brush your dentures. Pretty much, it's really easy. All you want to do is you want to take your dentures and then you just kind of hold on to them really good and then just brush them like you normally would in a circular motion with your toothbrush and toothpaste. It's always best to use toothpaste. Even though they're not real teeth, you always want to use toothpaste because that's just going to keep them really good and clean. So you just brush them in a circular motion. You actually, too, it's always best to do is you want to go ahead and make sure you brush underneath, because sometimes food and debris can kind of get caught up underneath the ridge of the dentures. So make sure you brush underneath to, loosen up that food or debris that might be in there. And then when you're done, just make sure you always keep them really good and dry. And then you're always going to want to put them in a dipping bath afterwards, especially if you're getting ready to go to bed. You don't want to wear them at night because they can get loose and you might choke on them. So you always want to put them in a dipping bath afterwards, which would just be a cup of water. And you can actually buy like denture cleaning solution that you can put them in, but you would just put them in the dipping bath and let them sit there overnight. And then when you have placed the dentures in the dipping bath, you just let it sit there overnight. And then the next following morning, you take them out, just dry them off really good, place any adhesive that you need to place in there, and then put them in your mouth and then just start functioning with them. But once again, my name is Michelle, and I'm a dental assistant with Solutions, and I just showed you on how you can brush your dentures.
All right, so thanks to Michelle for helping us with the circular motion technique. So if you have any questions, sorry, can we pause that and just do that over?
No problem.
Thanks. All right. So 1, 2, 3, 4, 5. All right, thanks to Michelle for showing us the circular motion technique. So next we're going to talk about self-inspection. You may think that because you're just wearing a denture, you don't need to look at your mouth all the time. You just put the denture in, you take them out. Self-inspection is a very important aspect, especially when you have dentures. So it's important because the soft tissue can be negatively affected by the contact with the denture. So your soft tissue can experience reddening, inflammation, it can appear swollen, and it can experience discomfort. We like to call this denture stomatitis. And some of the risk factors that can cause denture stomatitis include Candida albicans, which is like a fungal infection. If you ever heard yeast infection, they're the same. And that usually it could present many different ways, but it can appear as white patches that sit on the soft tissue. And then biofilm, which is a bacterial accumulation. So we want to make sure that's why we're brushing our denture properly, because we don't want that bacteria to irritate the soft tissue, causing an irritation. And if you're constantly wearing your denture as well, your soft tissue needs time to breathe. So if you're wearing them all day and all night, you're not giving the soft tissue enough time to breathe. So that may cause irritation. And of course, some cigarette smoking as well can cause irritation to the soft tissue. So we want to make sure that we're looking in the mirror every single day to make sure that our soft tissues appear the same on both sides. And if you notice any changes, that's when you give your dentist a call and make an appointment to see them. So any residue from the bacteria that it could stay on the denture, some of that residual bacteria can actually contain part of the Candida albicans, which is that yeast infection. And if you're not cleaning your denture and you let the infection continue, you could keep reinfecting yourself with the same fungal infection. So you want to make sure that you're cleaning and make sure you're checking yourself to get that taken care of, because we don't want you to keep reinfecting yourself as well. So next, with the self-inspection examination, professional soft tissue examinations and oral cancer screenings are recommended at least 2 times a year for all patients, whether you have natural teeth, a partial denture, full denture, everyone. Daily examination should be performed by the patient, and you should take notice of oral changes and any symptoms, any discomfort, any discoloration. You should continually take note of that, especially if it's persisting over a couple days. Patients should record changes and seek dental care if the concerns continue. And especially with the denture, you want to make sure that, you know, the denture's looking good and make sure the oral tissues are looking good as well. So make sure you're noting any of those changes and then bring them up with your hygienist or your dentist. So how do we want to manage the soft tissues? We can rinse our soft tissues. So each time the denture is removed, the patient should rinse with either warm fluoridated water. And if you don't have fluoridated water, that's okay. You can use a warm salt water rinse. You can clean the soft tissues as well. The mucosal membrane should be brushed at least once a day with a soft bristled toothbrush like we talked about earlier. The toothbrush should have round-ended filaments, and you brush lightly over the ridges and into the vestibules. So the vestibules, it's the area where the lip and the gums meet. So it's all the way up here. So make sure you're getting the brush all the way up there. And you want to utilize long, easy strokes from the back to the front. So make sure you're really getting back there and light circular strokes to the front. We also want to stimulate circulation and increase resistance to trauma in the soft tissue. So what you're going to do is you can massage your gums as well. So digitally, you want to take your hands, you want to place your thumb and index finger like this, and you want to cup your soft tissue on both sides. It almost palpates. You're going to be making like these type of motions along the ridge of your gums. We just want to stimulate circulation to that area, especially because you will be wearing your denture all day. And you can also use a soft toothbrush and apply the soft sides of the filaments and almost create like a vibratory motion onto these areas to cause that stimulation as well. So you may think that just because you have dentures, you don't need to go to the dentist anymore. You're not going to get cavities. You already had your teeth extracted. Why go? Well, you need to have frequent appointments. They're needed to check the denture and the health of the gingival tissues as well. Routine extraoral and intraoral examinations for potential abnormalities need to be checked because we want to detect if there is any early detection of potential cancerous lesions as well. We also need to adjust the appliance because the mucosal membranes may shift over time. If you lose weight, the mucosal membrane may diminish a little bit over time. So we want to make sure we're making those adjustments because if you have an ill-fitting denture, that will cause irritation to the soft tissue as well. We want to evaluate the condition of the denture for any fractures, cracks, chips, worn teeth, and any broken clasp, just so you know you are completely comfortable in what you are wearing. And we want to check your periodontal health, which is just the health of the gums. So, as a review of what we just went over, we want to make sure to clean the denture several times a day throughout the day, whether in the morning, after every meal, or before bed. There are two main ways to clean your denture, either by mechanical cleaning or chemical immersion. And remember the circular technique that we had talked about. It's the best for mechanical cleaning. We want to continually inspect the oral soft tissues, and we want to note any changes that may occur. And you want to visit your dentist's office at least twice a year. It is key for optimal dental health, even when the patient has full dentures. Thank you so much for listening.
Thank you, Stephanie, for teaching us about denture care. I'm Carol, and I'll be talking next about periodontal disease. At the end of this section, I hope that you'll be able to explain the prevalence and risk factors for periodontal disease, the meaning of the terms gingivitis, periodontitis, and biofilm, proper maintenance of periodontal disease, and the relationship between periodontal disease and overall health. So why do we even care about periodontal disease? I mean, you're not going to get that, are you? Well, actually, 50% of adults over age 30 have periodontal disease. If we increase that age to 65, over 70% of older adults have some form of the disease, which makes this the leading cause of tooth loss in patients over age 45. So what can you do about it? What are your risk factors? Well, unfortunately, there are many. Several you cannot change. These include age, male gender, genetics, cancer, and immunosuppression. Fortunately, though, there are many that are modifiable, and these include things like smoking, alcohol, poor nutrition, obesity, poor home care, lack of professional care, and of course, stress. There are two forms of periodontal disease. First, we'll discuss gingivitis, and second, we'll talk about periodontitis. So to start, gingivitis is a bacterial infection that affects the gums only. These patients may have red, swollen gums that bleed easily when brushing. Fortunately, gingivitis is reversible if treated. If untreated, you may or may not progress to periodontitis, which is irreversible. If we look at the picture on the slide, at first glance you might think that those teeth don't look so bad. But when you look a little closer, particularly right here, where you can see I'm drawing with my arrow, right over the tops of the teeth, you can see that that tissue is quite a bit more red than the other gum tissue. And that would be a sign to your hygienist that that tissue is really not too happy. If you notice that in your own mouth, it might be a sign that you need to give your hygienist a call. If you don't have your gingivitis treated, you may or may not progress to periodontitis. Everyone's course will be a little bit different. Periodontitis is similar in that it's also a bacterial infection. But unlike gingivitis that only affects the gum tissue, this will now involve the bone and result in bone loss. The tissue itself may again look normal, or it may even have a red, blue, pale color to the gum tissue, which may be swollen and present with bleeding or pus when it's examined. Again, I've said it before and I'll keep saying it, periodontitis is irreversible and non-curable. This requires lifelong maintenance once you're diagnosed. Here's just one example of the many ways the gums can look in a patient with periodontitis. So focus your attention first right above the top teeth at this area that actually looks pretty pale. It's not the fiery, bright, angry red that you might expect in a patient with a disease, but this, as we mentioned, is one of the ways that your gums can look if you have periodontitis. If we look at the actual teeth, we can see right here where I'm drawing, there's a lot of plaque. And right next to that plaque is a small line of redness, which tells you that there's an infection starting to brew under there. If we shift our attention down here to the centrals of the lower teeth, this area right in the middle looks particularly unhappy. I imagine if you saw your dental professional and they put an instrument in there, you might actually get some pus. If you see that in your own mouth, it's definitely time to reach out to your dentist. This is an example of what a set of radiographs might look like in a patient that has periodontitis. Now, don't let this overwhelm you. I know it's a lot of x-rays and you may not be familiar with any of this, and that's okay. Focus your attention on the center image on the bottom row. I'm sure that you have no idea what you're looking at. So let's start with the simple basics. Bone is white, and either airspace or soft tissue like your gums would be black on an x-ray. Normally, we want that nice white bone to come almost all the way up in between these teeth where I'm drawing with the arrow. You can see on this patient that that space is almost completely black, which means they've lost a significant amount of bone. All of these teeth in that image are no longer solidly rooted in bone, which again is one of the reasons why periodontitis is the most common cause of tooth loss in patients over 45. So what exactly is the problem, Carol? What is the cause of gingivitis or periodontitis? Well, the problem in one word is biofilm. You may have heard this referred to commonly as plaque. Plaque, or biofilm, is living, thriving bacteria. Unfortunately, it starts to form just minutes after brushing and is permanently adherent to the tooth surface in as little as 48 hours. If we look at the picture, this is an actual microscope image of biofilm. The larger shapes right here are the actual bacteria, and all of the kind of small rod spindle shapes in the middle is kind of like super glue for the bacteria, holding them not only to each other, but to the tooth surface. This super glue, we'll call it, makes the biofilm extremely resistant to antibiotics and very difficult to treat. So how do we treat this once we have it? Well, gingivitis is a little bit more straightforward. There's really two main things you need to focus on. First, professional cleanings every 3 to 6 months. And then, of course, impeccable home care. If either of those is lacking, you may proceed along that slippery slope and result with periodontitis. The treatment here becomes a little bit more involved. The first step is a deep cleaning. In the dental world, we would call that non-surgical periodontal therapy. But don't let that intimidate you. Think of it as a really, really good cleaning. Second would be periodontal maintenance, visits every 3 to 6 months. These will help to prevent the progression or relapse of the disease. Your hygienist will also monitor your bone levels and help to prevent tooth loss. And of course, as with every visit, we'll give you individualized, personalized home care instructions. And lastly, impeccable home care for life. So why do we care so much about periodontal disease? I mean, it's just your teeth, right? Unfortunately, no. Periodontal disease has been shown to be linked to many systemic health conditions. First is diabetes. Periodontal disease has been shown to be directly related to glycemic control in patients with diabetes. But what does that even mean? Well, if you're a patient with diabetes and you're taking your medications the way they're prescribed and you're following a good diet and you're still not able to control your blood sugars, it means it actually may be time to reach out to your dental professional. Periodontal disease is also shown to be associated with increased risk of heart disease, as well as an increased risk of pneumonia. There are actually many other associations suspected with systemic diseases that haven't been scientifically proven quite yet. So what's the bottom line? There are 3 things I want you to take away from this. First, periodontal disease is largely preventable. Home care is number 1. Second, gingivitis is reversible. But once you progress to periodontitis, that is irreversible and not curable. And last but not least, I told you I said it before, and I'll say it again. Once a periodontitis patient, always a periodontitis patient. Thank you for your attention. That's the end of the periodontal disease section. Next up will be Sarah Moldari, who will be speaking about dry mouth.
Hi, my name is Sarah, and I'll be talking to you today about dry mouth. What I want you to learn today is what dry mouth is and the oral health side effects. What are the causes of dry mouth, the substances that can help reduce dry mouth, and the oral health practices that can help reduce it as well. So what is dry mouth? Simply put, dry mouth is a long or short-term reduced saliva flow in the mouth. And here we have 3 saliva glands: parotid, sublingual, and submandibular. So here are the oral signs that you should be looking for of a dry mouth. Number 1, we're looking at the mouth tissues. They can be dry, pale, red, and withered, and shriveled. So as you can see here in the first image above, mouth tissues, we have dry, pale mouth tissues. On the bottom, we have a picture of oral candidiasis. If you recall from Stephanie's mentioning of oral candidiasis, it is a fungal infection, and it is white patches in the back of the mouth. Next, we're moving on to the tongue. The taste buds, which are normally stippled, like little finger-like projections on your tongue, they can look withered or deteriorated, cracked, and inflamed. So if we look at the first picture here, we can see that the tongue surface is smooth. That is not the normal look of a tongue. That means that all the tongue taste buds have been withered away. And on the bottom, you can see there are cracks in the tongue, another sign of dry mouth, and it looks inflamed. It is red, it is just inflamed overall. Next, we have teeth. There can be multiple cavities, especially around the gum line and the roots of the teeth. Along the top here, we can see a lot of decay happening, a lot of cavities. And on the bottom as well, we can see around the roots or the gum line of the teeth having those dark areas. And we can also see some periodontitis in the front tooth here. We can see the root of the tooth exposed. Once again, that is not a normal, healthy mouth. So it's important to take a look for those signs, or once again, visit us at our clinic at MCPHS in Worcester to have us take a look at your mouth. What are the causes of dry mouth? There are many causes actually that can cause a dry mouth. We have lifestyle choices, dehydration. You're not drinking enough water every day. I know you have a busy life and people forget to stop and take a drink, but it's very important to keep drinking water all day, not only for your body, but for the health of your mouth. Emotional stress. When we're stressed, a lot of things can go wrong, especially causing dry mouth. Vitamin deficiency. There are some vitamins in our nutrition and daily nutritional intake that can cause dry mouth. Blocked saliva ducts with hard deposits. And when I say blocked saliva ducts, as in the first slide that I showed you, the 3 saliva ducts or the 3 saliva producing areas can get blocked with hard deposits of food or food that has been hard and mineralized. There can be also medical treatments that cause dry mouth, like medication side effects. More than half the medications that exist today that you are most likely taking can cause dry mouth. Local surgery in the mouth. If you have surgery in the mouth, that can also cause your mouth to dry up. If you have head and neck cancer, the radiation therapy is also another cause. And also, lastly, common illnesses such as diabetes, anemia, or Sjogren's syndrome can also be a good cause. But you're asking, why is dry mouth important to treat? Saliva stimulation or replacement therapy can keep the mouth moist, prevent cavities and fungal infection, like candidiasis, and provide soothing relief. If you'd like to take more of a prescription route, you can always talk to your dentist about getting prescriptions such as pilocarpine, which also comes in a liquid solution and tablets. And we also have Civamelin, which also comes in tablets as well. if you don't want to try over-the-counter or prescription ways of relieving dry mouth, there are some natural ways that you can try and help relieve these dry mouth symptoms. Sipping water frequently all day, letting ice melt in your mouth. Limit your caffeine intake. That means avoiding coffee, tea, or soda. Do not use alcohol mouth rinses. Use a humidifier in your sleeping area. Humidifier will help re-moisturize the air in your home and help prevent yourself from drying out, especially that oral cavity. Using lip balm, if you have any, will keep your lips nice and moisturized and also help your oral cavity as well. It's also important to note that chewing sugarless gum and sucking on sugarless mints will help stimulate saliva flow in your mouth. And I'm going to stress the importance of sugarless gum and sugarless mints because sugar can cause cavities, and we would like to avoid that. Thank you. That is the end of my presentation. And next we have Jaylene on nutrition.
Hi, everybody. My name is Jaylene, and I will be teaching my part of the presentation on nutrition. So here are a few learning objectives that I would like everybody to get out of my presentation, and they are understanding the importance of a healthy diet, identifying key components of a healthy diet, understanding the importance of the implication on frequent snacking on oral health, recognizing that carbohydrates and sugars are risks for cavities, and understanding why xylitol is preferred over other sugars. So to begin with, why is a healthy diet important? Diet can determine how your body functions. Diet and nutrition affect and are affected by the condition of the oral cavity. Good nutrition is the foundation for oral and general health. The oral cavity is the pathway to the rest of the body. Any problems in the oral cavity can greatly affect appetite, diet, and eventually nutritional status. So for example, if you are having issues in your oral cavity, you might avoid certain foods because they might be painful to eat, meaning you're going to lose the nutritional value from those certain foods. So realistically, your oral health and your overall nutrition coexist together. And the earliest clinical signs of poor nutrition are seen in or around the mouth. So this is a poster made by the USDA, and it's called My Plate. This represents how a balanced diet should look like and how your meals should be balanced out generally. You want to eat whole fruits and have a variety of vegetables. You want to make half of your grains whole grains. You want to have a variety of protein and consume dairy, preferably low-fat or fat-free milk or yogurt. And of course, if meat isn't your thing, you can get protein from other forms such as tofu and beans, and there are other non-dairy alternatives as well. Speaking to your primary care provider or dietitian will help you make sure you're getting your proper vitamins and nutrients. So frequent snacking, we all snack, of course. Who doesn't like to snack? An excessive consumption of certain types of carbohydrates can damage the tooth enamel. And the more often you snack in between meals, the higher the risk of damage. So carbohydrates, mostly known as carbs, break down into sugar in your mouth, meaning that they are just as equally as risk for creating cavities than sugar is. So some example of these carbohydrates that may put you at risk are cookies, biscuits, and chips. And so foods containing calcium or fluoride can actually help repair your teeth. Calcium is a mineral that helps keep your teeth strong and healthy, while fluoride is a mineral that helps prevent cavities. So these are two very important minerals to keep in your diet in order to have optimal oral health. So sugar in beverages, for example soda, can place a person at a higher risk, especially when it's being sipped over a long period of time. This is because your teeth are actually being exposed to the sugar and the acidity of, for example, a soda, and if you are sipping it over a long period of time, it will take longer for the saliva in your mouth to clean out all that sugar and acidity, meaning your teeth will be exposed and more vulnerable for longer. So in the end, saliva is the best protective agent against cavities, as Sarah just taught us. Did you know that 21.8% of adults 65 years and older are affected by dental cavities? The more often you consume sugar, the higher you are at risk for cavities. The risk is even higher if sticky sugars are being consumed in between meals. slowly dissolving foods are at very high risk for developing cavities. And examples of these are hard candies, which sometimes older adults use for saliva stimulation, breath mints, and cough drops. What is xylitol? Xylitol is a sugar alcohol that slows down the bacteria that can cause cavities. And due to its bacteria-fighting abilities, xylitol is preferred over other sugars. And when you are unable to brush and floss after a meal, it's recommended that you end the meal with a dairy product, or chew xylitol gum, or rinse thoroughly with water. And here is a little video that I wanted to show. So here are some tips that I wanted to share on how to keep your teeth safe. You want to avoid eating sugary, sticky, and chewy food after brushing teeth at night. And of course, you should always avoid eating after brushing your teeth for the night anyways. But when you're consuming things that are sugary and sticky and chewy, and you consume that after you brush your teeth, all that sugar is going to be sitting in your mouth overnight for several hours. So you want to avoid doing that. And you want to eat protein such as a cheese stick when you are snacking to balance out any sugar and carbs. And you want to avoid sucking on hard candies such as lollipops and cough drops. And like I mentioned, this does not mean that you have to completely avoid it. This just means you can do it in moderation, or you can, as Sarah mentioned, get sugar-free options and that has xylitol in it. And when drinking coffee or soda, you will want to wait at least 30 minutes to brush and floss. And if you can't wait 30 minutes, you should try rinsing with water and baking soda or water alone. And the reason this is because beverages such as coffee or soda can be acidic. And if you brush your teeth immediately after, this can be too abrasive for your teeth, and over time it may wear down the enamel. And you should drink any sugary or acidic beverages, for example soda, with your meals instead of alone in between meals. And that is the end of my presentation.
One, true or false? Implants do not need to be flossed daily because they are not real teeth. 2, true or false? A patient with a full denture still needs to visit the dentist twice a year. 3, true or false? Periodontitis is curable and reversible. 4, true or false? Dry mouth is a major risk factor for cavities. And 5, true or false? Only sugar causes cavities.
Now I am going to reveal the answer to these questions. So for the first question, implants do not need to be flossed daily because they are not real teeth. That question is false. Second question, a patient with a full denture still needs to visit the dentist twice a year. That question is true. Third question, periodontitis is reversible and curable. That question is false. Fourth question, dry mouth is a major risk for cavities. That question is true. And fifth question, only sugar causes cavities, and that question is false. So this is the end of our presentation. I hope you guys enjoyed and got a lot of valuable information from our presentation, and we hope you have a wonderful day. Thank you.